Hello. Welcome. My name is Dr. Calliope, and I'm going to be performing your examination today. How are you doing today? Okay. Well, I hope by the time you walk out of the clinic, you feel even just the smallest bit better, right? So let's see what we've got in store for you today. Alrighty, so real quick, would you mind if I grab your name and your date of birth? Okay. And is that the name you prefer to go by? Excellent. Wonderful. So, looks like today we are doing a cranial nerve examination. Is that correct? Excellent. And is there any particular reason that you wanted this examination done today? Okay, excellent. So I'm just going to ask you a few questions before we begin, okay? Nothing too invasive. Are you currently in any pain or have any illness at all? Okay. And any changes to the medical history that we have on file? Perfect. And what about your family history? Excellent to hear. And what about your allergies? Any changes to those at all? Very good. And what about your medication list? Everything up to date there? Fantastic. Alright, so for your cranial nerve examination today, we will be, of course, testing all your cranial nerves. So your cranial nerves are 12 pairs of nerves that arise from your brain and go all throughout your skull. So these can have different functions, like, for example, governing your sense of smell. Can also have motor functions or help with sensation or movement. They have all sorts of different functions. So we'll be doing a variety of tests in order to make sure that those are all intact and are reacting properly, right? Any questions so far? Okay, so for this examination, I will be, of course, needing to touch you. Is that okay with you? Do I have your consent to do that? Wonderful. All right. So to start out with, I would just like to take a very general inspection of you, of yourself, just to see if there's anything that I need to hone in on, okay? At any point during the examination you feel any pain or discomfort, please let me know, okay? Alright, so I'm going to step back here, and I'm just going to just take a look at your body as a whole. Make sure I'm not seeing any warning signs at all. That everything is symmetrical. There's nothing out of the ordinary. Just making sure everything looks normal, as it does. So, to start out with, we are going to test cranial nerve number 1, which is the olfactory nerve. The olfactory nerve governs your sense of smell, so we're going to be testing your sense of smell. So, I have a few little jars here, and I'm just going to unscrew the cap, and I'm going to have you take a smell. So firstly, I would like you to close your eyes and cover one of your nostrils. All right? Okay? And I'm just going to hold this up to your nose, and I just want you to tell me what the cap smells like. What does that smell like? Okay, coffee. Excellent. All right, so I'm going to put that back and then select another smell. Okay. And I want you to go ahead and switch nostrils. So you're covering the other nostril. Right? Keep your eyes closed. And what does this smell like to you? Okay, it smells like soap. Wonderful. And let's do one last one. You can go ahead and uncover both of your nostrils. There we are. And take a little smell of that. Very good. That was lemon. I could have accepted citrus as well. A lot of citrus smells are very, very similar. Excellent. Let me just note that down real quick. And then we are going to move on to your optic nerve. This is cranial nerve number 2, and this governs your eyesight. So firstly, I just am going to be getting a touch closer to you, and I want to inspect your pupils. I'm going to be looking at the size, the shape, and the alignment of your pupils, okay? Alright, so just going to get a touch closer here. And just have a little look. Right. Excellent. Very good. So next we're going to be testing a variety of pupillary responses. I have a pen light here, and we're going to start with the direct consensual response test. So for the direct consensual response test, I will be putting my hand up between your eyes here. All you have to do is just keep looking forward. I will bring my light in and shine it into one eye. The eye that I'm shining the light into should react to the light. That would be our direct response, as your eye is directly responding to the light that's being shined into it. And then if I do that same little maneuver, but watch the other eye instead, then your eye over here should react in the same manner at the same time to the eye that the light is shining into right here. That would be our consensual response, as both your eyes are consensually responding to the same light. So I'm just going to put my hand up between us, and I'm going to be shining the light into your eyes. Direct. 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 Excellent. Consensual. 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 Fantastic. Let's do that on the other side here. Direct. 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 Consensual. 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 Wonderful. So next I'm going to be performing the swinging light test. So all I'm going to do for this is turn on my light, shine it into one eye, and then swing to the other eye, and to the other, and to the other, back and forth, just looking for any defects in the way your eyes react, right? Wonderful. So bring this in, just shine the light, shine the light, shine the light, noticing any defects at all. Very good. Just going to be taking a couple of notes here, and then we will use the pen light once more. So I'm going to be testing your accommodation reflex now. So using our pen light, I'm going to have you focus on the light and follow it with your eyes. I'm going to be bringing it in and out, and I want you to just keep following that with your eyes without moving your head, all right? Wonderful. So just focus on the light as I bring it in and out, and in, and out, and in, and out. Excellent. Let's do that on the other side. In, and out, and in, and out, and in, and out. Wonderful. Okay, so I'm just going to note that down, and then we will be testing your eyes in a few more different ways. We're going to start off with testing your visual neglect. So I'd like you to just focus on my nose, and I'm going to be wiggling my fingers in your peripheral vision. I just want you to let me know when you see my fingers wiggle, okay? So just focus on my nose, and when you see my fingers wiggle, just let me know. Yes. Yes. Good. Good. Yes. 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 Excellent. Wonderful. There we are. So next we're going to be testing your visual fields. So I'm going to have you cover one eye or the other. Whatever eye you cover, I will cover that same side. And then I'm just going to be bringing my fingers in each quadrant of your eyesight. And I want you to let me know when my fingers come into view, okay? All right, so we'll cover our eyes. Just let me know when you see my fingers. Good. 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 Excellent. And the other side, okay? Good. Good. Yes. Yes. Very good. Excellent. Let me see here. Next, we're going to be testing your blind spot. So, what I'm going to be doing is have both of us cover our eyes, like in the last test, and I'll be bringing my pen just across your vision. I want you to let me know when you see it disappear, and then when you see it reappear, okay? All right. When does it disappear? And reappear. Disappear and reappear. Okay, other side. When does it disappear? Reappear. Disappear and reappear. Wonderful. It's a bit of a tricky one, that one is. Alrighty, and lastly, we're going to do a little fundoscopy. So, fundoscopy sounds like a Rather loaded word. But in reality, all it is I'm just going to be there, looking at the back of your eye and taking a look at your optic disc. Okay? So what I'm going to be doing is I will be placing my hand on top of your head to steady myself. I'm going to be coming in at sort of a diagonal angle, and when I find the red light reflex in your eyes, I'll be coming really close and taking a look at the inside of your eye. Fascinating, isn't it? Yeah. So we'll start on this side. I'm just going to turn on my ophthalmoscope and put my hand on top of your head. And I'm just going to search for the red light reflex. And then I'm just going to bring in the ophthalmoscope and take a look at the back of the eye, making sure that the optic nerve looks healthy, everything's intact, all the blood vessels look healthy. Okay, wonderful. I'm going to do that to the other side here. So just put my hand on top of your head. Let's take a little look. So, red light reflex right about there. And I'll just come in and take a little look-see at the optic disc. It's very interesting how this little tool can see the back of your eye, all through the jelly and whatnot. There we are. Wonderful. So, cranial nerve number 2 looks wonderful. And now we're going to be testing number 3, number 4, and number 6. These are the oculomotor, the trochlear, and the abducens cranial nerves. These all govern eye movement. So, firstly, I'm going to get a little close and we're going to check your eyes for any ptosis, okay? So, I'm just going to be coming real close and taking a look here, making sure there aren't any issues with any drooping. Wonderful. There we are. That looks great. So to test your eye movements, I'm going to grab my pen light again, and I'm going to have you follow this light using only your eyes without moving your head, and I'm just going to be moving it through the cardinal directions of gaze and making sure that there isn't any nystagmus, that there aren't any defects in the way that your eye performs in. So, just going to, my sleeves keep sliding down my arm. I'm just going to have you focus on this light, and again, using only your eyes without moving your head, I want you to follow the light. Just follow the light as best as you can, even if it goes slightly out of your visual field. Just follow the light as best as you can. Just follow the light. You're doing wonderfully. Follow the light. Very good. Let's go up, down, to the side, up, down, to the side, Let's go diagonally up, diagonally down, good. Wonderful. So now I'd like to check your corneal light reflex real quick. So all I'm going to be doing is just shining this light about 2 feet away from your eyes, right down the middle, and this will help check for the alignment of your eyes. I'm watching how the light bounces off of your eyes to make sure they're in alignment. All I need you to do is look straight ahead. So, just making sure everything looks aligned. All right, very good. Okay. After I do my notes real quick, we have one more test with the nerves 3, 4, and 6. So we're going to do the cover test for heterotropia. So what I'm going to have you do is just cover one eye, and we'll sit there for a moment. I'll watch the eye that's uncovered. We'll see if there's anything funny going on, okay? Alright, so just cover one of your eyes, and I'll watch this other one. See if there's anything wonky going on. If you have a real sketchy eye. Just a few moments more. Okay, go ahead and cover the other eye for me. Then we'll have a little watch on this one. Make sure that there isn't anything out of the ordinary going on. Very good. Your eyes are working just as they should. So next we're going to be testing your trigeminal nerve. Your trigeminal nerve is cranial nerve number 5, and it has both sensory and motor functions. So you have 3 regions of your trigeminal nerve. That's why it's called trigeminal, as that prefix tri means 3. You have your ophthalmic branch right here, your mandibular branch right here, or maxillary branch rather, and your mandibulary right here. So your mandibulary branch has the motor functions, and that helps with clenching your teeth, opening your jaw, and whatnot. But all of the branches of your trigeminal nerve have sensory functions. So let me go ahead and just note down for that cover test. Okay, so we're going to start with our sensory assessment. Firstly, I'm just going to have you close your eyes, and I'm just going to touch different portions of your face. And I just want you to let me know when you can feel me touch a spot on your face, okay? Alright, so go ahead and close your eyes. And we'll start here. Good. Here. Good. 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 Excellent. Perfect. Perfect. Excellent. Excellent. Very good. Wonderful. We're going to take that test one step further. And we're going to be doing the soft, sharp test. I have a sharp object, which is just a toothpick. I have a soft object, which is a cotton bud. I'm going to be just touching you in different spots with either the soft object or the sharp, and I just want you to let me know which one you feel, okay? So the sharp is not going to cause any pain, just a little poke. So if you'd like, I can just test it right here, okay? just give you a little poke. Okay, so that's the sharp, and then this will be the soft. Okay, very good. Go ahead and keep your eyes closed. Close your eyes. Right, let me know which you feel. Sharp, soft, soft, sharp, sharp, soft, 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 sharp, soft, sharp, soft. Wonderful. So next we're going to be doing our motor assessment of your mandibular region of the trigeminal nerve. So first I'm going to take a look at your temporalis and your masseter muscles here. I'm just going to be inspecting, doing a little bit of palpation here. Just making sure there's no wasting or there's not any sign of defect at all. Alright, so now I'm just going to be palpating the masseter muscle, and I want you to clench your teeth for me. Okay? Alright, and can you open your jaw for me? And close. And open. And close. Okay, excellent. I'm going to note that down real quick, and then we'll move on to the jaw jerk reflex. It sounds a little more involved than it really is. There we are. So the jaw jerk reflex is going to involve me just putting my thumb right about here on your chin and tapping it with my reflex hammer. All you have to do is open your mouth just slightly, not real wide, okay? And put my thumb right there. I'm just going to tap, tap. There we go. Not much at all happens, and that's what we like to see. So lastly, I could perform the corneal reflex, in which I would get a little cotton bud and touch the side of your eye with the cotton bud, but that tends to be a touch uncomfortable for people, and most generally you don't use that in a normal cranial nerve setting, so we are just going to skip that little test. We'll move on to the facial nerve. This is cranial nerve number 7, and it governs your expressions and your sense of taste. So it's both a sensory and motor functioning nerve. So, have you noticed any changes to your sense of taste lately? Okay. And what about your hearing? Any changes to that? Okay. We will test that a little bit in just a little bit. Alright, so firstly, I'd like to just take a little look at your face. Make sure there isn't any drooping or any defects at all. Anything that would affect the face or the facial nerve. Okay, but it looks like everything looks just fine, right? So I'm going to have you follow a few directions for me, okay? I'm going to have you make a few funny faces, if you will. So firstly, I'd like you to raise your eyebrows for me. Okay. And can you close your eyes real tight? I'm going to try to open them. I want you to resist me. Good. Good. And I want you to puff out your cheeks for me. Okay? I'm going to try to push them in. I want you to not let me. Okay, very good. And can you smile real wide for me? Excellent. And can you purse your lips? Very good. All right. Now we're going to move on to our vestibulocochlear nerve. This is cranial nerve number 8, and it is a sensory nerve that governs hearing and balance. So we've already established that you haven't had any issues with your hearing lately, but I'm just going to be performing a few tests nonetheless. So firstly, I'm just going to say a few words, and I want you to repeat back to me the words that I've said, okay? Right. Icicle. Curtain. Table. Light. Closet. Okay, what were those words? Excellent. So now I'm going to cover one ear and whisper some numbers into the other. Just want you to repeat back to me what you heard, okay? All right, so I'm going to cover this ear and whisper in this one. 88, 74, 12. What were those numbers? Great. Now I'll just cover the other. 16, 45, 93. And what were those? Very good. So I'm going to take a couple notes and then we will move on to the tuning fork part of our hearing exam. Excellent. So now we are going to be doing the Weber and Renee test. So I'm going to grab our tuning fork and our tuning fork hammer. Our tuning fork and our tuning fork hammer. So this really saves me from bruising up my wrist or my knee and makes it a lot louder. So for our Weber and Renee test, I'm just going to strike the tuning fork, put it in the middle of your forehead. I want you to let me know if you hear the sound on one side, the other, or right down the middle, okay? Hear that? What side is that on? Okay. What side is that on? Okay, right down the middle. Excellent. Okay, and next I'm going to be striking the tuning fork and putting it on the back of your ear here on the mastoid tip, little bone right there. I want you to let me know when you hear it and when it stops. Then I'm going to be bringing the tuning fork right in front of your ear. I want you to let me know when you hear it and then when it stops. Hear that? When's it stop? Hear that? And it stopped. Okay? Hear that? When's it stop? Hear that? Okay, and it stopped. Very good. Let's do that on the other side here. Hear that? When's it stop? Hear that? And it stopped, okay? Hear that? When's it stop? Hear that? And it stopped. Excellent. So lastly, I'm going to have you do a balance test for me. I'm going to have you get up and stretch your arms out to the side. I'm gonna have you close your eyes and then march in place, okay? All right, if you could just do that for me. I'm just going to make sure that you're not off balance, that you're not swaying to one side or the other. Okay, you can go ahead and stop, sit back down. Very good. So now we're going to be testing the glossopharyngeal and the vagus nerves. These are nerves number 9 and 10. These govern your swallowing and your speech. Have you had any issues with swallowing lately? Okay. And any changes to your voice at all? Right. And have you been dealing with any sort of coughing at all? Okay. All right. So I'm just going to grab my pen light and a tongue depressor. We're going to take a look inside your mouth. All right, so if you could open your mouth for me. Looks like we got popsicle sticks in this time instead of tongue depressors. Just gonna take a look inside your mouth and take a look at the soft palate and the uvula. You say ah for me, honey? Uh-huh. Very good. Okay. Excellent. You can go ahead and close your mouth. Alrighty. Can you cough for me? Just give a couple of coughs. Promise there isn't anything right after that. Yeah. Okay. Very good. Alright. We are moving right along to the accessory nerve, cranial nerve number 11. And this governs your neck and shoulder movement. So, firstly, I'm going to take a look at your trapezius and your sternocleidomastoid muscles, okay? So this is around your neck and your shoulders, of course. Have you noticed any difficulty moving these muscles or any pain? Okay, not more than usual, yeah. Yeah, it's a very, very easy area to get all tangled up. Okay, so I'm going to have you raise your shoulders for me. I'm going to try to press them down. I want you to resist me, okay? All right, very good. Can you just give me a shrug? Excellent. And I'm going to have you turn your head against my hand, okay? I'm just going to put my hand to the side of your head, and I'm going to have you turn it against it, okay? Turn against my hand. Good. And turn against my hand. Excellent. And lastly, we have the hypoglossal nerve. This governs your tongue movement. There's an entire cranial nerve dedicated just to tongue movement. So I'm just going to finish my notes. So firstly, I'd like you to just stick out your tongue for me. Okay. Alrighty. And can you lift your tongue to the roof of your mouth? Right. And can you stick out your tongue and move it from side to side? Okay. And how about up and down? Excellent. So I'm going to test your tongue strength now. And I'm just going to have you put your tongue on the inside of your cheek, like so, okay? And I'm just going to try to press that in. I want you to resist me. Okay, the other side. Very good. Okay, let your tongue rest. It's probably more tongue action than you've seen in a long time, huh? Yep, big mood, buddy. Alrighty. Very good. So, that about does it for us. You have any questions at all? Any concerns? Nope, you had a completely clean bill of health. I saw absolutely no defects that would lead me to believe that there is something neurological going on. You did everything just perfectly. Alrighty, well, if that is it, then we will wrap this up. So, I'd just like to thank you for coming into the clinic today and having me perform your cranial nerve examination. Really appreciate seeing you here. I hope that you have a whale of a day and a good rest of your night. Thank you so much. Goodbye now.
Thank you so much for watching. I really appreciate it. Please like this video if you want to, comment if you'd like to, and subscribe